Many kinds of diets, though, and now one calls for just not eating for days and may actually be beneficial in some ways. Dr. Reena Mehta is here to talk about intermittent fasting. Good morning.
Good morning.
All right, so let's talk about what this is, define it and how long it lasts.
Okay, so intermittent fasting is not a diet of food restriction, it's rather a dieting pattern. So what you're doing is you are not restricting what you're eating, but you're restricting the time that you do it. You're cycling between periods of eating and fasting.
All right, so you might have 500 some odd calories a day in that sort of thing, or it's like all, 1,500, 2,000, and then...
It's basically saying you can eat what you want during a period of time. And so the most common method is called the 16-8 method. And what you're doing during that time is that there's 16 hours of fasting and 8 hours of an eating time window. So most people fast when they sleep. So it's basically extending that interval of sleep so that your first meal, for example, may be at noon, and then your last meal may be at 8 p.m.
This is a little off the reservation, but there have been some studies that show if you want to lose weight and you don't go crazy during the day, just restricting, just not eating in the last several hours you're awake can make a difference too.
Right, so several studies have showed that intermittent fasting is not only an effective way to lose weight, but there may also be some other health benefits, such as decreasing type 2 diabetes, decreasing heart disease, Alzheimer's, and cancers. Now, those studies are small, but they're very promising.
We had a story earlier today where we talked about obesity and children, and I think the thing that should be alarm bell for parents is obviously all those things you associate with obesity, but then there's a cancer link too to obesity.
Exactly. And the concept of intermittent fasting is basically when you're fasting, your blood sugar and your insulin levels drop. When your insulin levels drop, it actually goes to your fat stores and depletes them, and that leads to weight loss.
All right, so there may be some trainers and others who are obviously very good at keeping the weight off who might look at this and say, no, you got to feed the fire. You got to have a lifestyle where you actually are eating a lot during the day, but the right kinds of foods. And if you go on this diet, it's not going to work in the long run.
Well, the whole point of intermittent fasting is during that period of eating, you're not binging. You're eating what you would otherwise regularly eat, but people find it a little bit easier than other types of dieting, like restricting calories, because you don't really have to think about what you're going to eat. You just have to decrease that interval.
Is it a long-term fix, though? Is it a lifestyle? Is it an effective lifestyle?
It could be. I mean, the concept of intermittent fasting, you have to stick with it. You can't be off and on and off and on. If you're going to do it, you have to do it for a period of months. And so the hope is that you can reduce some weight with also having some potential health benefits
and then my question would be, finally, this obviously is not for everybody. Some people, I would assume, need to talk to their doctor.
Exactly.
So age or whatever conditions.
Right.
Who should just do this?
So not everybody should just do this. It's something to think about if you're thinking about a way to lose weight, but it's really important. When you are intermittent fasting, you can drink water. So all you can do is you don't eat, but you can drink water and other non-caloric beverages such as tea and coffee. If you're actually thinking about doing this, I would highly suggest that you speak with your doctor before, because it's not for everyone. You need to go through your risk factors and see whether you would be a good candidate to try this diet, but it may be effective.
All right, so how long should somebody do this if they decide?
At least a month to see if you have benefits. Exactly.
Okay. All right, a month is long enough.
That's what the studies show.
Okay, well, we'll see. Dr. Reena Mehta, thanks.